So today we're talking about reports that golfing legend Tiger Woods underwent his seventh back surgery this past week for what appears to be a collapsed disc that was present in his spine. It's relevant to note that this is Woods' seventh back surgery, and he had a disc replacement, which is removal of a disc and replacement with a prosthetic disc that's meant to keep the movement intact. Interestingly, he had a prior fusion, and it appears that some of the problems may have been caused by adjacent level disease or arthritis that may have developed above the fusion level. So, what do I think about artificial discs? Well, artificial discs have been approved in the neck and the lower back for a number of years. My personal feeling is that cervical artificial discs have become a mainstay in my practice and in spine surgery, and the outcomes are uniformly positive, particularly when it comes to arm pain. Lumbar artificial disc, however, the outcomes have been somewhat more mixed, and I think a lot of that relates to patient factors as well as variability in terms in terms of causes for back pain itself. It's important to note that two of the major artificial discs in the market were pulled from the market. One was a Charité disc, which faced numerous lawsuits for misrepresentation of data. Another was the M6 disc produced by Orthofix, which was found to have almost a 1 in 3 incidence of osteolysis, which is bony destruction around the disc, which in many cases required revision of the disc itself. Now, what types of candidates make good candidates for lumbar artificial disc? It's a very difficult question to answer, but I think among the things we need to look at, one is the absence of severe instability. Generally, those cases are better managed with fusion. Generally, cases where the patient is a non-smoker, smokers generally do tend to have worse outcomes, both with fusion and disc replacement, as well as patients with lower BMIs, because the approach tends to be from the front and the complication rate tends to be less in lighter patients. So hopefully Tiger has a speedy recovery from his surgery, and we look forward to seeing him back on the golf course soon.